plain CT scan of a 10 years old male child. The patient is a known case of aqueduct stenosis and obstructive hydrocephalus. VP shunt was placed approximately 9 years ago. Now please observe, this is the fourth ventricle, which is narrowed. Cerebellar hemispheres are normal. Higher up there is aqueductal stenosis. I will show you this on the sagittal scans later on. Now please observe dilatation of extracerebral CSF spaces in the parieto-occipital region. This is suggestive of residual effects of previous ischemia. Thickness of white matter is reduced. This is because of the presence of previous hydrocephalus. This is the VP shunt. Its tip lies in the atrium of right lateral ventricle. Please observe colpocephaly and the typical appearance of frontal horns of both lateral ventricles. These are suggestive of presence of agenesis of corpus callosum. Now I will show you the sagittal, the coronal scan. Now this is the coronal scan. At places Fox cerebri is deficient. I scroll it back. In its interior part, corpus callosum is present like this here, but posteriorly this is deficient, and third ventricle rises up in between the lateral ventricles. Now here you don't find the corpus callosum in this region. Please note the colpocephaly. Now this is in the midline. This is the remains of the corpus callosum. This is dysmorphic. It is malformed. Only anterior part of the corpus callosum is visible, and that too is not normal. Posterior part of the body of corpus callosum and splenia, they are not visible. So there is an associated partial agenesis of the corpus callosum. Now this is the region of the aqueduct. There is aqueductal stenosis. This is fourth ventricle, quite narrowed here. Now this is the 3D. The skull has a schifocephalic shape. There is synostosis of the sagittal suture. Coronal and lambdoid sutures, they are patent.